Welcome back, y'all, to another episode of the Cinnamon and Spice Podcast.
All right, rank, sweet.
Not a dang thing. I'm Ak.
And I'm Nye.
Yes, happy Monday. Hope y'all are enjoying this series so far. We're just going to roll right on into it. Last week, we spoke about the cost of living. And as we all know, it's expensive out here, okay?
It is what it is.
Yeah. A big part of costs going up will then fall on things such as like healthcare and obviously also mental health on a lot of people. So we thought it was, important for us to like also hit on that, especially with it becoming, wintertime, a lot of people like, seasonal depression is a real thing when it starts to get cold. So I think right now, especially how things are moving in the country, it is important to speak about like access or lack thereof of therapy and, mental health resources. Me and Nigel are both advocates for it. We've both done our own therapy. Are you still in therapy?
No, I'm not.
Okay. Well, she was at one point. But why, if, I know you were using work benefits at one time. Mm-hmm. Is that why you don't use it anymore? Is that why you're not receiving it? Okay. Yeah. So you had cashed out on the free benefits, essentially. Because at the job we met at, what was it, 6 free sessions? How many free sessions?
Yeah, I think it was about
6 free sessions.
It was a lot because a lot of places do like 3.
Yeah. Even when I was with my last company, they did the 6 too. But even after I had got my 6, my therapist, they did accept my insurance, so I only had like a $20 copay, which was real reasonable. But I don't have that insurance no more, so I haven't seen my therapist yet until I get my new insurance with my new job. And then I'm going to see, hopefully, she accepts that so my copay stays low. But simple, like it. Just like with Naja, like a lot of people, it's crazy because some people don't even be knowing their jobs be having things like that. You said some jobs be offering 3.
Like ours,
people don't know that.
Yeah, where I'm at currently, they have 3 sessions, and like they have different ways where you could use it though. So either like for a mental health coach, or you could use it for like like a dietitian.
Yeah. Okay.
Like,
okay.
Yeah, like stuff like that. Yeah, but you only get like 3
of
sessions.
them.
Yeah, and then I think they have one that's like a financial advisor, like that kind of thing. So
you ain't cashed that on it? You ain't using it?
Yeah, I want to.
Is that every year they give y'all that, or is that just period?
I don't know if it's just period or like just in a. I do think it's just period. Knowing how my job is. But I wanted to use it for the dietitian aspect. Yeah. So
okay.
I want to use those 3 sessions to see if I can get some coaching worth like on that end.
Yeah.
Instead of mental health. I mean, not saying one is greater than the other. It's just if I only got 3.
They run into the same. That's why you can use it for that.
I'm like, if there's only 3 sessions though, I feel like I can gain
use
more.
it for what you need to.
Give me a meal plan.
No facts.
My business.
She's a mess. But now I feel it though. But like, I do think more jobs not only should offer more, because I do think that 3 is kind of like low. Yeah. But I understand like whatever.
They be cutting costs where
they can, right. Mm-hmm. But it's crazy because they do that and then like, are they even making it known to employees that they have that?
Yeah, what they say it every once in a while. But that is one of those things where I am diligent at. I will write down that type of stuff. Like, as soon as I see like certain flyers go out, I'm like, oh yeah, y'all offering what? Yeah. Okay, click. Or like where you know how they'll have like different discount programs. Mm-hmm. I'll be on them. Yeah. Looking at them websites.
Me too.
First before booking. Like, why are you not?
Man.
I don't care if it's 20%, 10%, 5%. You say I ain't got
First thing I do at a job
is sign up for all of them.
Yeah, I'm looking at every benefit I got. Okay, because
and I'm use that.
Okay, even if it's just 10% off here, 15% off there, that stuff add up. Mm-hmm. That help, and especially with mental health and therapy access because it is expensive.
Yes.
And so I understand why a lot of people you don't always tap into it, especially if they don't know their jobs offer it or if their job don't offer it. Because I know at one point my ex was seeing a therapist. Copay was like $180 per session.
$180 at that rate. That's when people start thinking, it's not that.
It's not worth it,
yeah.
Right? Like I could figure out other things to cope with, and that's the issue. Like mental health needs to be taken more seriously in this country. I mean, especially right now. We've been saying this since probably episode 1, but especially right now in these times and how hard it is from like the cost of living to people losing benefits to, it's a bunch of things that can go into depression or, it affecting your mental health. So it's like people do need to take that a little bit more serious, but it's hard when they don't even have good access to it. And then the cost of it is too much. Like some insurances, even with insurance, it may not be a $20 copay like mine. You may still be paying upwards of $100 or even more. So it's like, that's insane. But again, this country wants it. Like they set it up like that purposely.
For profit. And I feel like there should be certain industries that shouldn't be for profit. Like, and health being one of them. Yes. I don't care if it's mental, physical, like just healthcare in general should be affordable. Universal. And it should be accessible. Like it should be something where, preventatives are prioritized over the
oh gosh, yes.
Because even still, it's like, okay, we get it. Like y'all end goal is for everyone to be very, very sickly. Okay, cool.
That's what they're making money off of.
Okay, but at least let it be where hey, we'll give you the antidote to the preventatives if you want it.
Yeah, like have that option. Yeah.
Have it as an option.
But they don't care. So. They do not care about preventative. So much so as even if you do have insurance and they say preventative care is covered at 100% most of the time, but you go to the doctors and
they still looking for something.
They looking for something, and then some of them preventative care like getting you tested like for certain things, like having a full panel ran on you so you can really know what's up. That is not even free sometimes.
Yeah,
so it's like
they'll tell you, you need to have certain symptoms before to even being.
So it's like that's not real preventative care. They want you to be sick already before they even care about seeing you and giving you any type of service, which it should be the opposite way around. I feel like they could low key make more money, and maybe not, because I don't always know the logistics behind like how they do make money. I know a lot of it is off the medicine, but it's like, okay, if we change the medicines from being like curing to just preventing, I'm sure the money would help.
But that is the part, and from being like previously in the medical field, and this is what drove me out of it, was purely the fact that none of the medications that we take are to cure. No. They don't cure anything.
Yeah, no.
So it's solely just to mask symptoms and make those more manageable. And when you start thinking of it like that, it's like, dang, like, you don't really feel like you're helping. Because, like, at the end of the day, you still have this issue. It's just now, you might also have poops because of the medicine that you're on. Like, it's like... It's going to cause... Which is, like, it's to mask certain symptoms, but it's going to give you other symptoms that you may end up needing a whole nother pill for. Exactly. So now you're on this cycle. Loop, and you got 4 or 5 pills that you're now taking for what? Yeah. So...
Over-medicated.
Yeah, I don't know. And even with the medications, it doesn't cost much for them to make them either. Insulin does not cost much to make.
I'm really thankful for that law that they had passed to where now they're not charging people an arm and a leg for insulin. It's capped at like $35. No, it's not.
Oh, I thought it was only California that passed that, because I was going to say, like, not everybody's...
No, that's not. That's a federal law. Yeah, they capped insulin at $35.
Yeah, I'm gonna have to check, because they should have been did that, but like...
Yeah, they did that, and Kamala helped do that during Biden's administration.
Oh, okay.
Yeah. But even then, see, people don't even know that. Yeah. So, yeah, like, but nah, it's a federal law. They're not supposed to be charging people more than a certain amount on insulin now.
Yeah, but all that stuff is like, there should be some type of cap, considering, like, it does not cost that much to make.
It don't.
So if you got the pill to keep these people...
It's costing y'all $2 or less to make a pill, and then y'all charging people $200 for that same pill. That is so greedy. Like, on a pill that might cause people to have to take another pill, like that stuff. And it kind of ties into, like, sometimes anyways, like, kind of medical racism, but not all the way, because, I mean, that's just for profit, essentially. But, like, medical racism does play into some of this as well, because, I mean, we know as Black women how they do us. Like,
said, baby, all you getting is a Tylenol or ibuprofen.
Yeah. But
they don't care what you got
our white counterparts will go in with the same symptoms, saying the same things, and they're going to give them exactly what they need, whether it's oxycodone, whatever the case may be. But because I'm a Black woman, they don't care how... They think my pain is less than, and I'm not really...
also, like, in charting, use certain words to make it seem like, oh, well, look like they're seeking medication, or came in aggressive. Like, baby, if I'm in pain, I'm not gonna...
You think I'm gonna be sweet?
Yeah, I'm not gonna be
Yes, I'm aggressive, girl. My back hurt.
Like, yeah, like...
Get this pain out of me. Like, if you got to shoot me in the side with some medication, give me a pill, like, I don't know why you think I'm about to come in here sweet. Especially, again, like, my white counterpart come in acting the exact same, and y'all do not flag her.
Yeah.
Y'all go give it to her, and she might actually be the fiend. Mm-hmm. But because she don't look like me,
it sucks. There's a lot of like mistrust in like black people don't trust the doctors. Yeah, and it's like rightfully so because y'all proven several times that y'all cannot be trusted.
Nah, right.
Like whether that's y'all stealing people's cells to make medicines and then not y'all making millions, billions of dollars off that, but they're not seeing a dime.
Nah, nothing.
They ain't seeing a dime. Or y'all purposely, inject us with certain illnesses just to see what will happen.
What will happen, yeah.
But it's not consensual. It's something where, later down the line, they're like, oh, dang, so that wasn't a vaccine.
Nope.
That was...
You were a test dummy. A lab rat, per se. Yeah.
And then why is this allowed? Like,
right. But this is why we need more of our own, like, black and brown people in the medical field. And I say that loosely on the brown side because I've personally encountered, a situation down when I was in Georgia where I had minority doctors and they treated me like shit. Mm. Like, they for sure treated me like I was less than. And so it's like, yeah, I'm all for more minorities being in there, but really I just want more black people. Oh. More black people. And even that...
And people who care because,
seriously.
Like, even when I was going through, like, nursing school, there was a lot of people that you could tell were... They're just for profit. Mm-hmm. Like, they know...
They doing it just for the money.
Yeah, like, if you're the type of person where you're like, oh, yeah, all I need to do is work these 412s and I could book this, or 615s and I can have this... Mm-hmm. I don't want you, respectfully, because...
I want somebody who enjoys helping people, who enjoys, like, their job and not here for the check. I mean, we all going to work for the check. Obviously, the cost of living is high. We need the money. I get that. I'm not...
around the way.
I'm leaving here with something.
So I feel you on that.
I'm leaving here with something, but...
like, when you are in certain fields where you are catering or servicing people...
Yep.
It's like, dang, your heart should be in it,
yes.
too. And it just sucks that with the way that cost of living is, it's like, dang, well... I mean, people are just looking at the numbers. Mm-hmm. Like, how much can I make by doing this? Yeah. And that is the motive.
It's sad.
If that'll get you through the school, then...
Yeah, it's sad. And it's too many of us out.
Yes.
It's not us particularly, but it's just too many people out there who only going into the medical field for the money.
Yeah.
And it's crazy because when I was back in high school and I was originally thinking about what I wanted to do with my life, I don't know if I ever told you, I originally wanted to be an OBGYN. Mm-hmm. But then I was realistic, when I looked at the schooling and the requirements it took to become an OBGYN, I said, oh, no. I don't care that much. I don't care that much to go through 10, 12 years of school to then be in $100,000 worth of debt, to do that. Do I care about women? Yes. Do I care about childbirth? Yes. Do I care about, advocating for people who look like me? Yes. But I'm like, I'm going to find another way to do that.
Yeah.
That's not particularly that. I mean, I love the people who do it, but again, if you're going to do it for the right reasons outside of the money. Because if you're going to school for that long to get into that much debt, it is important that you in there doing it for the right reasons. Because, okay, you're going to make good money, but you still got to pay that debt back. Yeah. That debt bill high. I
don't know.
Money can be the motive all you want, but if money is really that motive, you need to go into sales and not healthcare.
They say, okay.
As a person in sales... You need to go, and yes, the money is the motive, but I am someone who truly cares about people. So that's why I'm in healthcare sales type shit, like, and excuse my language, whatever. But yeah, like, it's ways y'all can go about it without actually being in customer facing or people facing jobs where y'all are just completely disregarding people's emotions and symptoms and pain and all that stuff. Like, it get bad out here. Like,
and even with those type of people, it's like, okay, I mean, there are a lot of people that be faking. There's a lot of people that are just seeking,
It's not a lot of people. That's a small percentage of people who really be faking. We got to watch our words on that. Everybody not just going to the doctor faking for some pills. You think so?
I done seen some regulars. That's where it's like...
You've seen regulars, though.
But that's what I'm saying.
It's the same people, though, right?
Yeah, I guess you could say the same people. But it's like, all I'm saying truly is that I see both sides. Like, I get it. And, like, there is burnout in the healthcare where it's okay... When you are encountering someone, you need to treat that person like it's the first time you ever met them.
Yeah.
You shouldn't be going based off of fact like, oh, snap. Like, all right, Mr. Willie, I done seen you here
5 times
3
this
times
week.
already. Mm-hmm. And, you still... Like, I get it. Like, but there should be plans in place where even when you're getting burnt out, you're not treating people the same.
I agree with that. I agree with that.
12 hours is kind of crazy.
Crazy. Some of them running longer than that.
Yeah.
Shit,
like
y'all strong.
12, 14, 18 hours.
I'm barely making through my 8-hour shift.
It's crazy.
And y'all doing
10,
12.
12, 14s, like, that's crazy.
Yeah. Power to y'all.
Crazy.
Power to y'all. It's tough out here. Like, it's already, we deal with discrimination or whatever, medical racism, but then we also have to figure out, because those same people, some of them people are just trying to navigate.
They could just be trying to seek shelter. Because once again, cost of living is so damn high.
I was just about to say that. Some of them people are doing it because they just need a warm bed at night or some type of free sandwich or whatever they can get. Because the same people will try to, get into the jail just for some. It's do a little petty crime just so I can get booked just so I can get in jail to get a nice warm meal. Like and that'd be enough. Yeah. Like, it ain't a good meal, but it's a meal. Like there should be just some resources for people where it's like you don't necessarily have to take the route of filling up a bed that isn't for you. Mm-hmm. We should have a bed for you. Absolutely. There's too many vacant buildings for us not to have a bed for you. So many vacant buildings that literally could be turned into homeless shelters, low income apartments. We could just do so much. Yeah. So much. And they just sitting there. People, if they really care, especially these people who own these buildings. Like if they really cared, like if you're going to let an abandoned building sit there and not make you any income for years on end, then turn it into a low income house, apartment complex. Yeah, something. Like do something to get put back into that community. Our lawmakers, that shouldn't even be possible. Like you should not have a building that's just sitting vacant. Yeah. Now they do need to be. Yeah, I agree with that too, which is sad. But just going back to even with the healthcare thing, a lot of people avoid because we were saying we don't have too much trust in doctors nowadays just because how that go. But some people simply avoid the hospitals and stuff so because they can't afford it. Medical bills are crazy. Yeah, and now. I think they just passed that law. What was it last year where they said it can't hurt your credit no more, quote unquote? Yeah. I think, and I need to read back into that because I know it's some gray area. Some gray area in there. So I need to read back up on that. But I'm like, okay, cool. But it's how are people navigating without insurance? Like me, I'm going through these couple months gap between jobs without insurance. So I'm I know, I was supposed to have a cleaning on my teeth last week, but I know I couldn't go to that because I don't have my insurance for my last job and I had to wait till I get my insurance for my next job. So I got to push that back. But then there are some people who they're not just dealing with a gap. Yeah. They just don't have it, right? They can't afford it because maybe their employer don't contribute enough and they can't afford to pay that extra out of their check for that. And it's no other small resources to where it could be a one size fits all. Maybe they don't qualify for Medicaid. So it's it's unfair seeing people really have to avoid a lot of things simply because they don't even have insurance. And they know that costs that bill. They may not have some places, you can go to the hospital, which is why a lot of people resort to the hospital a lot of time. You can go there, they have to treat you. Mm-hmm. And you just you can worry about that bill later. Yeah. But it's you can't always do that at the dentist's office or some doctor's offices. They want money right there. Yeah. You don't got insurance, cool. Well, you're going to pay this first. And then we'll service you. Right. Call me. And it's kind of sad. I'm going to school to be a dental hygienist right now. And it's crazy because prior to me even making that decision, I kind of had a little encounter at my old dentist office because they look me dead in the face and tell me I need a root canal and that shit $1,200. And I tell them, okay, with my insurance? Yeah. They say yes. And then I'm sitting there I don't have it. And they sit there with a straight face well, what you want to do? What do you mean? This tooth hurts. I need it out of my mouth. Yeah. And it's the root canal $1,200, but just to pull the tooth was $50. Mm-hmm. So I gotta miss a tooth. Hey. And it is what it is. It'll get fixed. I get an implant eventually, but it's that's insane. Yeah, that you even had to decide that. Well, mind you. And I only got the missing tooth because it put me in the hospital because it was so painful. I couldn't afford the root canal. And so I kept dealing with the little pains that caused a huge pain that I'm sitting in the hospital. And then why did the hospital don't have dentists in there to pull the tooth? That kind of irritated the life out of me too. Which I understand why doctors don't want to do that, whatever. Get this tooth out of my mouth. Yeah. Because it is also crazy when you think about it. Okay, we have teeth doctor, dentists. Mm-hmm. We have eye doctors. We have different specialty doctors. Mm-hmm. And then you have the overall doctor. Yeah, medicals. But then it's it's everything's a money grab. Yeah.
Why is there that many doctors? Like, bro, like this is all the human.
Doctor.
Yeah, this is all the this is the human body. Like, you should be able to do all of this.
You would think so. Yeah. You would really think, but it is a lot of knowledge that goes into a lot of this stuff. Like, so I get why there's sometimes doctors that specialize in certain things, but again, I think it would just be easier if, again, it was just universal. If it was universal, and instead of, having to do it, we can just pay those, like, our taxes are going towards, a bucket that pays all these doctors, so then we can go and see these doctors whenever we need to. I would, whether it's the dentist or your foot doctor, your eye doctor, whatever the case may be, I would rather do that than having to pay, first of all, separately for everything, because I think dental and vision needs to be included with medical insurance. I don't understand why they're all separate, especially dental. Vision, sometimes I can understand why vision is separate, because everybody don't have issues with their sight. But dental insurance needs to be added in medical. That needs to be a thing. Dental insurance is always it's like a joke. It's a joke.
Even if you feel like you got a good dental plan, it could be better. Like,
You don't. Because the max I've seen from someone who sold those type of policies, the max I've seen on a dental policy, because you have your annual benefit amount, right? Which is telling you how much. In case y'all don't know, with dental insurance, you have an amount in which the insurance agrees how much they will cover every year. Most dental insurances only cover $1,000. Unless you're paying attention and you got a little extra money to get the $2,000 and $3,000. I think $3,000 is the most I've ever seen. And there may be some that do more, but when I was doing it,
do not get those plans. So
so it's like you got $1,000 that they gonna contribute for the whole year, right? However, even that is like, okay, it's $1,000, but you need a $1,200 root canal. That whole $1,000 isn't going to that. Yeah. They only gonna cover about 80%, so you gotta cover the rest. And then that really just depends on your dentist and your insurance. So it's like, it's even more to it that people don't even understand. Like, dental insurance really is, I'm telling you, a scam. It's not beneficial. Yeah. It's
honestly, healthcare in America is a scam.
It's not beneficial.
And that's why we're talking about this topic.
Right.
Because I need y'all to understand, like, they're robbing us blind. Especially when the people that we fuel, like, that we send money to, they have it. So we're paying for it with our taxes so other people can have it. Yeah. I just need y'all to understand.
Yeah.
They have it.
Yeah.
We're paying for other people to have it.
Universal.
So it's not a foreign concept. Mm-hmm. It is something that they could adopt. They just refuse to.
Yeah.
And with that being said, I mean,
it's the cost of being in a capitalistic society. Yeah. I guess they don't care about nothing but the dollars. Yeah. And if the numbers don't add up to them, they quite frankly don't care.
All about the Benjamins.
Mm-hmm. Which it's a lot of pros. It's a lot of cons and very few pros to that. Mm-hmm. Yeah. So think about that. Do you got health care? Do you got dental insurance? Do you got eye coverage? Okay. Probably not. And if you do, how much you paying for it? How much are you paying monthly? How much are you paying when you go to the doctor? Because that's what it really matters. Like, for real. Let us know, for real. Like, how are y'all feeling about the healthcare system? How are y'all feeling about mental health and access to, like, therapy and other mental health resources? Because really, we need more. Like, I know it's a lot of mental health sites out there that kind of can give you, like, better help and other things like that has some cheaper ways for y'all to get, but even for some people that still might not be affordable. So let us know, like, do y'all know any resources for people, lower income people especially, for them to be able to get maybe therapy session or even, what would you talk about, dietary? Because I think that'd be beneficial for some people too. Because if people can switch up their diet, then maybe they can cure some other things, right? And help prevent people from diabetes and high blood pressure and all this extra stuff. But let us know in the comments how y'all felt about this episode and healthcare and mental health all around in this country, because truly, we're tired. We know y'all tired. So let us know how tired y'all are with us, okay? But make sure y'all are liking, commenting, sharing, subscribing, interacting with this video right here on YouTube. If you have watched to the end, comment right now if you've watched to the very end. We appreciate it. I want to see who has watched to the end, because the numbers are saying otherwise. Y'all ain't watching to the end. I need to see it. So like she said, drop a pink heart if you are seeing this part of the video. We appreciate y'all. Click on that link in our Instagram where y'all can donate to the podcast. We really appreciate that as well. But we appreciate y'all for tuning in again on this wonderful Monday. We'll see y'all again next week. Right, bye.